You've heard about arm lifts, but what is that? I'm Joubin Gabbay, board-certified plastic surgeon in Beverly Hills. I'm the clinical chief of plastic surgery at Cedars-Sinai, and I'm going to tell you everything you need to know about the arm lift, or the brachioplasty, or bat wing removal, or whatever you want to call it. The bottom line is, after certain situations in life, some people are left with a lot of loose skin in their arm. Now, there are a lot of different ways people get to that point, and there are a lot of different ways that we can approach someone with loose skin on their arm. So let's talk about it. The most common way that you get to needing an arm lift is whatever brings you to a place of having a lot of loose skin. Most commonly, it's someone who's had a lot of fullness in the arm in the past and then has lost a significant amount of weight. Now, that may be after changes from pregnancy. That may be the result of taking certain weight loss medications or having weight loss surgery, or it can even be with the natural progression of time where you develop a lot more loose skin in the arm than you had before. Whatever it is, by the time someone comes to my office to be looked at for their arms, I'm looking at a couple of very specific things. I'm looking at the overall amount of loose skin there is in that arm. I'm looking at where that loose skin is. I'm looking at the amount of fat underneath the skin of the arms, all over the place, looking at it separately in the shoulder, in the bicep area, underneath the arm, looking at the muscle underneath there, looking at the structure underneath there. And finally, I'm not just looking at your arm. I am going to look at the whole body and see where everything works. There are some patients who just have loose skin limited to the inner aspect of the arm. Some, it's all over. Some have a lot of loose skin that extends down to the side of the chest or even onto the breast. And we will often look at those bigger pictures and take a more holistic approach to an area, or in other cases, we will be laser focused on, let's say, just the inner aspect of the arm. So, what are the things we can do to lift your arm, to tighten up that loose skin? Well, at its most basic, let's say I look at someone who's got a little bit of looseness here, they've got some fullness in the arm, they have some extra fat. In a very limited circumstance, I can just do some liposuction and count on the natural elasticity of your arm to just pop right back up there and give a beautiful result. That happens most commonly in patients who are young, who have super thick and elastic skin and don't have a lot of loose skin. As a next step, in those who may have a little bit more loose skin, we can use certain skin tightening technologies to shrink that skin up after the liposuction. This is especially important because, look, often that fat underneath your skin is holding out, pushing out that skin. So when that fat's gone, the skin may droop a little bit more, and you want to use an adjunct to it. We would use things like Renuvion, like quantum, retraction, BodyTite. There are any number of different skin tightening technologies that are available for this purpose. But what if you have a little bit more skin, and there is a point at which I will tell a patient, hey, listen, I don't think one of these skin tightening technologies is really gonna do it for you. We need to think about literally the gold standard of skin reduction, and that is skin reduction. So by cutting out a certain amount of skin, you pull, you tighten, and that is the most effective way of managing loose skin in an arm. Now, there are a couple of different approaches that are commonly used. One is called the mini arm lift or crescent arm lift, where we will take a little sliver of skin, usually close to the armpit. We'll just pull out the remaining skin out here, and that can tighten a limited amount, usually of the closest part of the arm skin to your chest. It's a minimal approach for minimal loose skin. It does have some considerations that we should consider, including the fact that that scar, which is now in your armpit, sometimes can migrate. So it's a big thing for a conversation. Now, let's talk about the true gold standard. For someone who has a significant amount of loose skin down their arm, especially loose skin that goes from the beginning to the end, they need the classic brachioplasty or arm lift. That operation is one where usually there's incision all the way along the arm in some place or another. We'll talk about that. That's an operation that is the most definitive way of just allowing me to tighten up that skin as much as I need to more naturally and beautifully wrap around the entirety of your arm. That incision may be something that goes midway through the arm. It may go to the elbow. I've even done cases where it goes all the way down the forearm. It really is dependent on how much loose skin you have. Now, here's another little thing about that, which I said earlier. A lot of patients who have loose skin here will often have loose skin down the side of the chest. And one of my favorite combinations is to combine an arm lift with what we call a lateral chest lift, or the side of your chest lift, where we'll just pinch out the skin here to create a cohesively tight unit along that upper torso. It looks so beautiful when you need it. So there's a lot of different approaches to loose skin in the arm, and doing it the right way is exactly what will get you that best result. Now, talking about doing it the right way, I have a lot of very specific approaches that I take that are a little unique and certainly different than the old school way of teaching how to do this operation. I like to do what I call a preservation arm lift, where I laser focus on the two things I want to get rid of in an arm or lateral chest lift, and only those, and I do not take out anything else. So my special approach to the arm lift is to identify the areas of skin that I plan on removing. I identify the areas of the arm or chest that have excess fat that I also may want to reduce. And I do a very specific, high-definition, targeted liposuction procedure in advance of that arm lift. I will go in there and contour your arm on the outside. I will identify the area that I want to cut out the skin, and I will take out every drop of fat I can in that area. Because what that allows me to do is take out all the fat that I don't want, because who wants fat in that area? And it helps me preserve all of the really important structures that I do not want to touch and I do not want to damage. Blood vessels, nerves, lymphatic structures, structural elements, all of the good stuff. I keep that good stuff, I take out the fat, and I literally will just cut your skin and peel it off, allowing me to close everything together with a minimum of trauma. I say that because the old-fashioned way of doing an arm lift was way more destructive, and it's something that I do not like to do. What they used to do was literally just cut from the skin here down to the muscle, here down to the muscle, and just peel everything out. That took out a lot. It caused a lot of trauma. It created a big empty space that often resulted in a very, very high rate of complications. So this allows you to recover more easily, more effectively, and is a much more elegant approach to managing your arm, your lateral chest, or really any part of a body that needs some sort of skin reduction. So this just shows that there is a lot to think about with the arm lift. I hope this helps explain it to you better. If you enjoyed this video, you want to learn more about plastic surgery and all the different techniques that we have, be sure to subscribe to my channel, follow me. We'll show you everything you need to know.